Welcome everyone to the Thrive Wearables track today at the Giant Health Show. Really delighted to be back at the show again for the third year running, in fact. And although it's a little bit different this year, Thrive are bringing excellent speakers again and looking to run some of these workshop sessions or roundtable sessions where we explore some really exciting themes in the world of wearable tech. And I'm especially excited today to be talking about hearable tech, because this is a big topic and something that I think in 2021 is going to be big news. And I think we have a pretty impressive panel today in terms of those working really directly in that focus space of ear-based technology. So I'm really delighted to introduce the panel. Just before I do that, if you want to get in touch with anyone on the panel, you can find their details at thrivewearables.com/giant2020, or you'll be able to also find them on the Giant website. So please do get in touch with the speakers if you want to ask them questions about what you're seeing today and what you're hearing from them about what they're up to. There will be plenty of time at the end of the session for audience questions. So we're really excited to be taking those questions through the day and listening to some of the answers later on. So please put those questions to the panel and they'll be addressed as efficiently as we can at the end of the session today. So without further ado, I'm going to, in no particular order, go around and just ask the speakers to introduce themselves today. And I'm going to start with you, Tim. Tim Antos from Kokoon.
Hi everyone, I'm Tim Antos, CEO and co-founder of Kokoon. So at Kokoon, we help people sleep and relax easier using audio. So in essence, we take some of the coaching that you typically get in a sleep clinic and make it more accessible to anyone. So we monitor various biometrics and we collect various data. And that enables us to deliver personalized coaching, so CBTI-based coaching to help people improve their sleep and get more from their downtime. So we've got two products, our Nightbuds product, which is a tiny in-ear product, and then our Relax product, which is a larger over-ear product. You can actually check out our Nightbuds product now. We've just launched that new product. Just search nightbuds.co and you'll be able to find some exciting information on that product.
Fantastic, thanks Tim. And Pauline O'Callaghan from Hearable Labs. Would you like to introduce yourself?
Hi, so yeah, I'm Polly. I'm founder of Hearable Labs, and we develop innovative technologies for hearables. We also provide engineering services to companies developing hearables, be it startups or established companies that are branching into that segment. And my background is electronic engineering, and I started the company about 2 years ago. Previous to that, I'd been developing a hearable device, and I realized, as probably everybody here has, that there are a lot of engineering challenges to overcome with hearables, from making the hardware really, really small to fit in your ear, making it work in real time on a very small battery, and just having that really nice user experience, great audio that people expect from their headphones. So I started Hearable Labs with the idea that we would solve some of these engineering challenges for companies so that more hearables can get to market, because I really believe there's a huge potential impact that they could have on people's health and people's lives. So, and I think the other panelists here are really the leaders in that field today. So I'm really excited to be part of this.
Fantastic, thanks, Polly. Johannes Kreuzer from Cosinuss, please introduce yourself.
Yeah, my name is Johannes Kreuzer. I'm the founder and the CEO from Cosinuss, and we develop products in the ear with measuring medical grade vital parameters, SpO2 level, oxygen saturation, temperature, heart rate, respiration rate. At the moment, we have a very big study with COVID patients who are monitored at home with our devices. So it's a remote patient monitoring system. We also transfer the data coming from the ear to the clinic, and then they can take care about it. We are now a medical company, medical certificated company, and this is the main focus on it's the sensors and how to get the best signals out of the sensors.
Fantastic, and I can certainly endorse your technology as well. We've had it in the lab and looked at that in detail. So really great to have you on the panel. Alan Davis from Nuheara, would you like to introduce yourself, please?
Thanks, Jacob. Yeah, my name's Alan Davis from Nuheara. I'm the Chief Product Officer, so I'm responsible for all the product development activities in the company. Nuheara is a hearing hearables company, so we really focus on the hearing aspect of hearables and trying to provide a lot of hearing function in devices. We're not really targeting trying to be a hearing aid, so we're not really a hearing aid, but we are kind of your first hearing device. So that throws up a lot of really interesting challenges around trying to provide hearing enhancement. How do you personalize for your ears and that sort of thing? We have about 3 products that we've developed, and our latest one, our Max product, just was listed as one of the top 100 inventions of 2020 by Time. So we're really excited by that. But yeah, we think the hearing space is still huge and has a lot of innovation to go.
Yeah, congratulations on that, Alan. Fantastic achievement for your company and for the Hearables, sort of qualifying it as a thing, I suppose, and the public are going to catch up eventually. So we've just got to keep plugging. I'm going to start with you, Tim, because we've known each other quite a while, and I remember talking to you way back when you were talking about EEG and sleep. So that's a brainwave measurement for those who don't understand what EEG is. Yeah, I guess I always had this sort of frustration with EEG. Somebody who has worked on the sensors before and found very few applications for those signals. The brain is very complex. EEG is pretty simple. Tell us how you've kind of leveraged that signal for what you do, because it's to me a real killer combination in terms of the sleep and the brainwave side of things.
Yeah, so but basically our kind of key goal is to get as much insight as accurate insight as we can about how that individual's relaxing, falling to sleep, and then how they're sleeping, and that really kind of helps us kind of understand that individual. So EEG is obviously a really good technology for measuring sleep. We've actually kind of expanded our measurements. So we use a number of different parameters that we then combine to get a total kind of a holistic view of various sources of data to give a more robust data. Because one of the things in the consumer space is that it's very uncontrolled and people will wear things in different ways. And we just need to ensure that we have robust data. And EEG is one of these technologies that can be very good, and it can also have poor signal. So what we do is we combine a number of biomarkers to really get the best spread of data. So our current Nightbuds product is looking at heart rate variability as well, and combining that to really build a picture of that individual, how they're sleeping and what's going on. And I really think that the move into the natural habitat of the individual is one of the key things, because it's very, I don't know if you've ever done a sleep study, but it's incredibly intrusive when you've got kind of stuff glued to your head, wires hanging everywhere. It's just incredibly unnatural. And we may not be at the, we come close to, but we're not at that clinical level of accuracy. But what we are able to do is collect a lot more data over a much wider time period in a more natural setting. And we actually find that incredibly powerful in helping us kind of optimize and improve that individual's challenges.
Yeah, that's really interesting. I'm going to come back and ask you about data a bit later on, I think. Johannes, you have a lot of sensors involved in what you do. You're looking at signals and measuring them in a very rigorous and scientific way, almost not to be unfair, Tim, but at the other end of the spectrum, where the user experience side of things and the kind of productization side of things have not had to take hold, and that obviously introduces compromises. And as you said, you're not at that sort of bleeding edge scientific level. And how do you find sensors are moving on, Johannes, in terms of what you can measure in the ear, the sort of qualification against gold standards? Where is the ear at when it comes to measurements?
Yeah, so I would say the ear is one of the best places to measure. Of course, you can't measure there everything. ECG, for example, is it's not really a good place, but everything else, starting with core temperature, if you want to monitor body core temperature, the ear is one of the best places or convenient places. Of course, there are some internal probes and something like that, but SpO2, every optical measurement, it's the best place inside the ear. It's dark inside. You don't have muscles. You don't have a lot of movements, and even you don't move your head a lot. For example, all the wrist watches, you write on the keyboard, you write, you're doing movements, and you move your head very slow and not so much. So this is why it's a very good starting point for all the measurements, and this is why we get there also much higher quality out of this data. And even in at a place where it's not the user or the wearer is not so disturbed, because we are used to have something in the ear, we are used to have something at the ear, whatever. It's not a patch where you have to stick it somewhere and something like that. So this is why it's a very good place on the one side. It's a one place where you get a lot of data and where you also then can extract out of this data a lot of more parameters. So that's why I'm sure that it's one of the best places there to measure.
It's interesting though. So I guess, Pauline, maybe I'll ask you this question. Why hasn't the Hearable taken over in a deeper way so far? Is it to do with engineering challenges? Is it to do with sensors not being small enough? Why hasn't the ear become kind of bigger, quicker?
Yeah, I think there's been a really big barrier there in terms of startups getting into the Hearables game. There's been some really interesting Kickstarters over the years and other crowdfunding campaigns for Hearables, but most of the time you don't see them actually even getting to make their product because they've underestimated how much the engineering challenges are. So that means that aside from a small number of new companies who can actually get Hearables to market, you're relying on the older and bigger and more established companies, which are always slower to move. But I think, I agree with you that over the next year or so, it's going to get really interesting because I think more and more those engineering challenges are getting smaller. And I think the more we can get even the playing field and lower those barriers to entry, the more interesting Hearables we'll see come from all directions, not just from the established players. And I think we'll see Hearables take hold more than.
Yeah, I mean, it's an incredible feat of engineering to do anything in that form factor, just because I'm a bit of a dinosaur when it comes to engineering. And, I've just seen these things shrink and shrink. It's absolutely astonishing. I mean, I guess there are other reasons things are opening up. Of course, Apple's products have paved the way to a great extent, although they're not exactly cutting edge relative to what's going on in the space. But there's other things like regulations as well. I guess, Alan, you've benefited from things in the US changing. Is that fair to say in terms of opening up the hearing aid market, for example?
Yeah, I mean there is regulatory change happening in the US. It's kind of been announced, but it hasn't been enacted yet. So they have new OTC regulations, so people can purchase hearing aids over the counter. There are ways people sell hearing aids over the counter already over there, but we think that regulation is going to create a new market for people looking for entry-level hearing devices. So when that comes along, so it hasn't actually been put in place yet, but we think you're going to see hearing devices in retail shelves and much more accessible and much better user experience as well, so people can buy these and set them up themselves rather than the traditional audiological approach. Just circling back to the sensor topic, Jacob, I think also that the wrist is a little bit different as well, and it's perhaps a factor of how long you wear the product, because sometimes on the, you can wear your watch all day, but hearables are very situational at the moment. They don't have the battery life yet to be worn all day. They only have 5, 6, maybe 7 hours for some products, and people kind of take them on and off. So I think that's also just to jump onto that last question, because I had some thoughts while you were talking about it. But I think that's also a factor that driving the adoption of some of those technologies. And as the battery life gets better, we're going to see those things happen, I think.
It's tantalizing, isn't it? Kind of every facet of wearable tech seems to need kind of just about double the battery. And so from a physics point of view, that's not sort of monumental. But it does really feel like that battery equation, is there throughout all of the discussions I have with Wearable, virtually all of them, unless the form factor is particularly conducive. So, I can imagine with a Hearable technology, you've got, really serious demands on that battery. But I guess we are seeing quite a bit coming from industry in terms of low power silicon, for example, which, 5-6 years ago was just not a thing relative to where it's at now. So there is a convergence, I suppose, between those two things. So going back to your point about situational and kind of people wearing sporadically and therefore maybe interrupting data sets, I would say for a start, probably the data sets you get even in that case are considerably better than you would traditionally with people, doing spot measurements of their health parameters, for example. But anyway, they're not wearing those things all the time. You do see a lot of people wearing Apple products all the time, the Apple earbuds all the time. Is it going to be a thing in the future where people are just constantly augmented when it comes to their hearing? Because it's fairly low friction, isn't it, to have those things in? And as long as you're getting the right social interactions and you've broken that barrier, wearing of glasses is a thing that people do for 8-10 hours a day, will it get to that stage?
I think we're going to see that. If you look at hearing aids, the big difference between a hearable product like ours and a hearing aid is actually how you wear it and how long you wear it for. A hearing aid has been designed to be worn all day, and the technology and the power usage in those is really incredible. They have really leading low power electronics in those devices, and they've managed to make them run all day. And nowadays they're rechargeable, and they do have Bluetooth and wireless connectivity in them. So I think we're going to see those two things converge, and maybe those devices have been really focused on hearing, but later we're going to see some really interesting products from Hearables companies that are going to bring convergence there and provide different options.
And your point, Jacob, about the data sets are going to be better than just spot measurements. I think that's an important one as well, because definitely at the moment and maybe even in the future, Hearables won't be something that you'll have on 24/7 or even maybe 12 hours a day. But if you take, for example, fertility tracking, like I know women who wake up every morning and take their temperature and write it in an app, and aside from the user experience of that, they're just getting one data point a day and they use it to manage this big aspect of their health. So if you, like what Johannes is working on with the measuring core body temperature inside the ear, if you're, for example, sleeping with something like that that's a game changer for women.
Yeah, that's really interesting. So I was going to go on to this data thing because I had a question for Tim, really. I think probably you've got one of the longest data sets of all the panelists today, potentially. I'm speculating, but you've been taking data from sleep conditions for a long time. What stuff's coming along on the back of that knowledge and insight from that data?
Yeah, so our big thing is really helping people with life challenges that they have. So I'm struggling with too much stress, or I'm struggling to improve my sleep, or I have issues with sleep, and what we're really able to do is take quite it does have data, but sleep science is quite established and solid, and we're able to take this quite established and solid science and apply big data to it. So really optimize the details, the nuances in how to help someone with their challenge, because we have a much bigger data set, and we can see, right, trying this little thing or doing this exercise is more effective than this exercise. So we're much, we're able to apply big data to the challenge of helping someone with those challenges, and that's just something that's not been able to do before. To get data sets on the level that you need to wire up thousands of people for multiple days to get kind of comparable data sets, and this is why kind of what we're doing, we really hope to push the science forward, as well as taking what's already there to customers. We also want to help push it forward, and this is why our kind of sleep scientists are so excited, because they've never had so much data to use to help with these challenges. And just rewinding back a little bit, with Kokoon, we are really pushing for as close to the kind of clinical standards of accuracy as possible. But it's just about kind of realism with ourselves. We know we're not going to get to that lab level, but we can get very close to that lab level, and we're regularly comparing against kind of clinical gold standards and continuing to push that thing. And I think that's where some of the most exciting advances have been in sensor advances of late, is how much closer we've been able to get to that gold standard way of measuring over the last kind of 4 or 5 years that we've been really focusing on that. So it's really exciting just to see how accurate our latest devices are.
Yeah, that's fantastic. I mean, I'd love to talk more, maybe offline about that, the data set and where you're going with it. Johannes, broadening this out a bit, what are the other application areas in the ear? I see that you're working in the epilepsy space. Are there some obvious sort of low-hanging fruit applications that really should be happening in the ear, as it were?
That's a good question. So there are a lot of things which are, let's say, the combination of several sensors, or even that you say you use the temperature for detecting fever, or like Pauline for tracking fertility, something like that. And what we see, it's always the combination of several requirements or something like that, but they lead more or less to the same devices or the same products, which is quite good, because we have the big advantage. We have 4 of the 5 vital parameters, and on the 5th we are working on it, and they are the standard parameters. When you go to your doctor, when you go to a clinic, if you have an accident, they will take the vital parameters. That's the first thing that they will do. And then they use it because you had an accident, or they use the temperature for fertility tracking, or they use something like that. But this is the big advantage. And I also, I agree with Tim. So sometimes you don't need this lab accuracy or something like that. So this very unusual setting or something like that. But you get the real life, and you get the data real life and long time and something like that. And for example, as what we have now with the COVID patients, they are at home, they are having more or less their real life. Of course, they are ill, but and the doctors were not used to it. They were used to it that the patient is sitting, he's not moving, he's not talking, he's nothing doing, and then they get a measurement, so the accuracy of the SpO2 level or something like that, it's quite good. And if the patient was moving, he said, please don't move. And now this patient is walking around, they only see the data, they don't know what happened, they don't know why something happened or something like that. And this is what now changed, so that and this is also with epilepsy and something like that, you will never get in this real life the highest accuracy. This is not possible because people are moving and something like that. But you need the context information, and then it's possible to have a much better overview about the patient, about the treatment, or about the illness and something like that. And this is, I think, what changed. And then you will have a lot of more application where you can use hearables, where you can use sensors in the ear, if it's for epilepsy, or if it's for sepsis detection, something like that. And then you have all the firefighters, the army, and all the workers who are in a dangerous environment. And there are a lot of applications which are then able on this technology.
That's really interesting. I think, yeah, I love the idea that you've got those critical measures all there to play with this sort of application area that spans out from there. And it just sort of highlights just how little progress has been made so far and what the opportunity is, I guess. So I'm really, as I said at the beginning, really excited to see where it goes. I want to talk about the bigger picture, I suppose. So we've got wearables, we've got hearable technologies in the ear. How can we start to kind of imagine a network of things? So augmenting those technologies with other things. We talk to some of our clients when we're talking about kind of care in the home applications, about having other parts of a wearable ecosystem. So you kind of imagine an out-of-box experience, which is plug something into the mains, put something on your body, and for that to be automatically connected and working. So in particular cases where people have neurodegenerative diseases, for example, it may be really beneficial to just have a really super simple out-of-box experience and everything's working, all configured completely, no Wi-Fi passwords, all that sort of stuff. Are there other ways broader than that hearables can kind of start melting into the landscape of technology in a sort of quite organic way? And what are the sort of technologies that might enable that? It's a bit of a broad question, but has anyone got any thoughts on that kind of subject?
I think one of the advantages of having something in your ear is the data that you can get from your other wearables. So if I'm wearing a patch, like to detect my sugar levels or something like that, okay, I might have an LED or something, but I can't really get data from that in real time and understand what it means without looking at a screen. And this is one of the things anyway that I hope Hearables will achieve, is to kind of unglue us from our screens a little bit, where we can be more heads up, actually present in our environment with just a layer of extra information via audio. But I think, so for example, if I'm wearing this sugar level sensor and my sugar level spikes because of something I ate an hour ago, and okay, I could look at the app sporadically or maybe get a push notification, but it would be really nice to have something natural in the background where, maybe from the field of auditory display, I'm hearing a certain level of background kind of beep or something like this that tells me when my sugar level has spiked, so that at the same time I can kind of assess how my body feels. Like, am I tired, or am I full of energy, and does that have something to do with my sugar levels, where it's not this I need to look at a screen and process the information and think about what that means, but it's this more natural in the background. I almost like feeling something happened in your body. You just hear that your sugar level spiked. And so I think that's where Hearables can kind of join and become a network with other wearables and provide advantages in that way.
It's challenging, isn't it? The sort of notion of interruption, and when you're in a social setting and you're engaging in that context, it seems like a long way away where a wearable or a hearable can actually kind of be sensitive to that and to be interrupting that conversation to tell you about that other thing. And I think that's probably one of the challenges with things like smart glasses and how much of a flop kind of Google Glass was for multiple reasons. But that kind of interruption and that sort of sense of like, are you with me or are you with your technology? So I think the challenge, the UX challenge, and the sort of, I mean, Alan, you must have kind of a whole load of thinking around this stuff because you're kind of designing a system that inherently is continually partially interrupting to some degree. It's kind of augmenting and flavoring and tempering your hearing. Do you, I mean, turning to that actually, and sort of going back to the augmentation thing that I was talking about, I know you've got other things that are non-hearable as well that are in your ecosystem. How do you kind of manage all of that stuff from that perspective, and then from the user experience side of things and the sort of sensitivity to social stuff?
Yeah, absolutely. We, the killer app for the ear is hearing stuff, right? So it sounds obvious, but sometimes it's easy to forget. And we do build out some kind of, we call them accessories, but they're really ways to interact with your environment in different ways. So one of the things we provide is something that allows you to connect your hearable straight to your TV and hear the sound coming straight out of your TV. And it's not, it's a bit different to other things out there in that there's no pairing required. So it has a really different user experience. You access it through an app and you just tap on it, and then all of a sudden you can hear your TV clearly. And that's kind of a way to put your hearing, focused onto the TV or whatever it is you want it to do. And I think that's kind of a generic concept and can be very much extended to all your smart speakers around your home. And you can start asking yourself questions about, well, okay, many years ago I would have had one microphone in my home, which is my, in my telephone, right? Nowadays you've probably got 50 microphones in your house or more. And they might be able to help you hear better, right? If you can tap into those in a smart way, and if you can figure out the usability for that and how your hearing might follow around these things in the room, and you can use them to actually augment and improve what you're hearing, because instead of having 2 ears now just on your head, you've got 50 around your house that can do all sorts of things. So I think that's going to be a huge growth area for hearables, and there's some real, incredible potential that can be had there, but some amazing technological challenges to solve there, and usability challenges as well. I'm just trying to figure out what it should be doing when is one of the bigger problems, right? You can probably get the tech working already, but making it actually seamless and usable and useful is probably another challenge.
Yeah, and just to add to that, I think kind of, I can see a world where that this kind of a standardized quality of data that you can get out there from these different sources. And our long-term ambition with Kokoon is not to be tied to devices. It's to basically be a company that process data of that individual in the real world and give them personalized coaching based on that data. And kind of right now we have to make the devices because there's not the accuracy in the other metrics out there, that there's not the kind of controlled way of delivering it. But we're looking forward to a world where we're not constrained to our devices, where we can work with many different devices and we can get the kind of level of insight that we need and deliver it back. So that's the kind of the world that we're looking forward to, because really we're a feedback loop, we're a kind of control system where we're learning about the individual and then kind of speaking to them and giving them insights back. Yeah.
It's fascinating. I mean, I can imagine it's a little way off in terms of what you guys.
Oh, it's a long way off. Yeah.
Because of user experience issues, not least. I mean, your product is inherently designed to be slept in, whereas many others will not be, I guess. So Johannes, on that note around sort of where the hearable stops and where other things start, I suppose. What's the limit of what we're able to do with the signals that are coming from the sensors in the ear? Batteries, all this stuff's been talked about. There's also the data transport side of things. Networks are not what they could be. Will they ever be there? Ubiquitously, unlikely for some time. 5G is going to solve all of our problems. Where are we at with getting that information out of the ear, and how much can we kind of process on board, as it were, at this stage?
Yeah. So at the moment, let's say it's really this distributing the data. It's, of course, we can measure a lot. We also increase the runtime, increase the battery capacity and something like that. But at the end, sometimes, of course, you can use the ear for the information. So you get a beep or you get a sound or something like that. But normally you want to transfer the data, because normally you also have to visualize the data. So the user, the doctor, or who else wants to see the data and not hear data. And then, of course, at the moment, you use Bluetooth, which is quite good, but it's also limited. If you go to 5G, then the power, it's the other problem. So normally, it's this typical Bluetooth to Wi-Fi, Bluetooth to something other. You need some hub, and if you then, so this will be, I guess, in the next years still a challenge. That at the ear it has to be small. It has to be very small. So you can't. So normally you need some kind of hub for the data. But at the end, it would be quite good if, let's say, every smartphone can receive my data and then transferring it to my data, to my database or something like that. So normally it's always my data is coming to my smartphone. If my smartphone is not there, it's lost or it's stored there or something like that. But there are so many devices around who can receive on the one side Bluetooth signals and on the other side transfer to a server. So that's what I hopefully, but I'm not sure if it really will happen, that I'm sending the data and it will go to my cloud solution or something like that. But I don't know via which hub it was going. Of course, privacy, encryption, and something like that, that's a big challenge then. But at the end, it would be very nice, because this is normally the real challenge when you are at the ear. The transfer to a cloud solution or something like that. And then, of course, with medical, in real time, medical grade, with everything related there. But at the end, I guess it could help a lot, because when I have an accident, my data is in the clinic and they know what to do, and they can do something like that. So, and if I'm sleeping, if I want to track my fertility, everything, it's the same setting, but you need the data not at your ear, you need the data somewhere else.
So, okay, let's be contentious then. What about smartphones? We sort of use this horrible thing that's the user experience is terrible. It's kind of bulky, and I like to imagine at some point in time, I won't give a particular point in time, but at some point in time, I see that disappearing. And we talked about using the hearing as an interface. Okay, well, first of all, starting with the smartwatch, this is a sort of move in the right direction to some degree. We've got a screen, we've got better sensors in a smartwatch than we have in a smartphone. So we've got health implications with a smartwatch, but there are some obvious problems. Would it be possible for us to kind of move towards ears and potentially glasses as the killer kind of combination for all of our connectivity needs? Polly, help me out with that. Can we get rid of the smartphone?
I don't think we'll get rid of it, and not anytime soon anyway, but definitely I'd like to see us reduce our reliance on it. And it's interesting you bring up smartwatches. I think in some ways they're worse because, like what you said earlier about when you're in a situation with somebody and you're looking at your screen and they're wondering if you really want to be there or if you're somewhere else. And I find when you're with somebody who has a smartwatch and they keep looking at it, it's this very strange thing where what it used to mean when somebody looked at their watch was they really need to be somewhere, or they're bored, or they're not interested in being where they are. But yeah, I think there are definitely a lot of apps that could be translated or transferred from the visual domain into the audio only domain. There are a lot that can't as well, because, for example, if you glance at your smartphone, you can see immediately what time it is, what's the date, what your battery life is, who texted you, what's on your calendar. Like, you can see that and process it almost immediately, because the visual to mental path there is like very, very quick. Whereas with audio, it's slower and it's lower bandwidth. So the same information might be battery 70%, and this kind of thing that you get with audio at the moment. But then I mentioned earlier the field of auditory display, where you transfer data from being in this spoken or written form and into series of kind of beeps and boops, or different things that you can more naturally understand, like a kind of audio shorthand. So I'd really like to see apps, starting to be transferred over into the audio only domain, the ones that can. So like navigation, or being able to control your hearing device so you can change what you're hearing in a certain setting, like choose which direction you want to hear from, or choose which hearing profile, or boost the bass, or whatever it is. And that you can do that without having to get out of your present environment and enter this other world, but to just adjust it on the go.
That's fascinating. I love the idea of kind of, getting around that bandwidth, as you call it, that limitation between visual and audible. Have you got stuff that you do with what you're working on, Alan, in terms of a kind of layered and multifaceted approach to audio, or is it just about the hearing and the sound, as it were, from the environment?
Yeah, we do have a bit of a multifaceted approach, because our products are a bit different from traditional hearables, where generally you have that, a lot of hearables product talk about transparency, and it's off most of the time. You have to enable it, but our products is kind of on, because hearing's the first application, and music and phone calls and that sort of thing are kind of the second application. So our products are always layering the phone call and the music and those sort of things together with your your environmental sound. And in a way that the systems that do that are a little bit artificial at the moment, because you hear a sound that's being presented, it's not rendered in your environment, if that makes sense. So sound generated from around you is presented in a way that matches what you see. So it's going to come from a certain direction, and you can see that with your eyes and that sort of thing. Whereas sound from your devices and through the the audio link is presented in a bit of a different way. So I think there is a lot of opportunity there to really explore how you do those sort of things, and how you create those auditory scenes and that sort of thing. And I think Polly's really right there about the bandwidth of hearing, and what is the right information to give through your ears. It's probably not going to be the same as what you present visually, right? You probably want to do something a little bit different there, and find ways to augment rather than replace. And they do that in things like airplanes. In an airplane cockpit, the plane talks to you as it's landing, right? So people know, people have found ways to do that, and I think there's probably big scope to do that in Hearables still too.
It feels to me like there are very few technologies which are in any way sensitive to other people beyond the user. So like smartphones, watches, all of it, it's kind of a distraction from a social interaction. And I haven't really seen a product that kind of pays any attention to any other users apart from the one that's right there, and that's not done particularly well in many cases. So think there's a lot of food for sort of thought around and the idea of sort of community, experience as well as your own.
Yeah, and on that topic, sounds really interesting thing. You can kind of close your eyes and not look at something, and you can not touch something if you don't want to feel it, and you can not eat it if you don't want to taste it, but your ears are always on. And traditionally, if you want to present something, in an auditory way, without hearables, everyone hears it, right? But hearables give you a different way. You can provide more personalized information to people now, and getting back to that kind of all-day way,
or less experience for the community. You're actually creating a barrier. So right. That's what I'm saying. But no, it goes both ways. But I'm gonna ask a couple of questions. Sorry to interject there, Alan, but we're almost at the end of the time. I wanted to kind of ask two things. First of all, just quickly to go around and see what your biggest challenge is right now. Where are you at with your work, and what's the thing that that keeps you up at night? What are you trying to solve right now? Let's start with Polly.
I think funding is always an issue for startups, and certainly for us. So I think there's so many exciting things to work on and to solve in this area, like all the different engineering challenges. There's so many opportunities, a lot of them we talked about today. The limitation is on how much funding we can get to actually work on them.
Tim?
I'd probably echo that, to be honest. I think there's so much opportunity there, and it's sometimes frustrating at the limitations of how fast we can run at these things, and it tends to be how tight a team can we manage with our runway, etc. I think kind of there's so much potential, and it's tremendously exciting that I think it's just a matter of time, really.
Alan.
Yeah, Hearables is incredibly multidisciplinary, and to really solve the problems, you have to tick a lot of boxes to make good hearables, and that's really a challenge. One of the things we're always focusing on is the user experience and bringing like an at-home hearing experience. And how do you do that? Because that service is traditionally delivered by audiologists in a clinic. So that's one of the things we focus on really hard, and it's a lot more than the device. There's a lot of human factors that need to be taken into account and brought into the hearables and the journey. So that's a big focus for us.
Fantastic. And Johannes, what's your challenge for 2021?
Yeah, the challenge is for us, it's the let's say the conservative medical market. So the medical market, it's very slow. Now it's a little bit speeding up based on Corona, but it's the digitalization, the openness for new technologies is really, you have to push it. I don't know, we push it since 8 years roundabout, and now we are at where we say, okay, now we are where we wanted to be 7 years ago. So it's very slow, and this is sometimes a little bit frustrating, but I guess it's now getting better.
Fantastic. Well, good luck to all of you. I'm going to ask one final question. Will Apple enter the health tech market this year with a hearable product?
I would say they already have.
Yeah?
Yeah, I mean, with the new iOS, you can already put in your hearing profile and adjust the transparency to your own hearing profile. So I would say that's a health application.
Yeah, fair point. I was probably referring a bit more to sensors and kind of a bigger play, but yeah, no, I think it's definitely shows a sign, doesn't it? They're going in that direction. Any other thoughts?
Yeah, we definitely believe that at some point they're going to get more sophisticated with what they do. I think they're typically a follower after things are proven out. I think they were going to want to see the clear use cases, the clear kind of customer, demand for these things.
So is that a no maybe in 2021? Maybe
2021. Yeah, I really doubt that they're going to do anything that's not been done or proven out before, but we'll see.
There's a fair bit out there, though. Let's face it. I mean, it's not. Philips have got an established technology in the market. I've got some in my bag, and you guys are coming out with stuff. So I think it'll be quite quick. I would say they will come out with something, to be honest. But I'm putting my neck on the line big time there. Alan, what do you reckon?
I wouldn't want to speculate. They so they can do anything. Yeah, no, I'll sit on the fence there. Yeah, they could. Yeah, you don't know. You don't know what they're going to do. They're yeah.
We'll see. Johannes?
We'll see.
Yeah, I think it's the direction where they are leading to. So it's quite obvious, I would say. And the other side, it makes sense. That's the other. We'll
see where it goes. It's fantastic to have spoken to you all. I really appreciate your time and for coming on the track today. Yeah, as I said at the beginning, we'll have questions coming up next. So hopefully there's some good stuff in the pipeline for that. Just to note, all the speakers have their information on thrivewearables.com/giant2020. If you'd like to go and hook up with them and connect and talk about more of what you've heard today, please do. But yeah, carry on with questions in the various channels, and we'll get over to those straight away now. So thanks again to the panel for today's session.
Thank you.
Thanks.
Thank you.